the recording.
And then I'll go ahead. There we go. So thank you, Tyrone, and thank you to everyone for joining today. So my name is Jessica Dangles, and I am the Executive Director of the Certification Board of Infection Control and Epidemiology. And I am joining you today from Chicago. So just to kind of get things going, if you want to put in the chat where you're joining us today from, that's always fun to see what kind of diversity we have in terms of geography with our attendees. So I'm going to go through CBIC certification on my portion of the call today, and then we will actually hear a personal story from someone who recently gained his certification in infection control. And then I'll open up the floor for questions at the end. So enough about me. I think Tyrone gave a great introduction, but what is CBIC? So I'm not sure what the familiarity is with CBIC on this call, but we are the Certification Board of Infection Control and Epidemiology. We are a voluntary, autonomous, multidisciplinary board, meaning that our board is made up of individuals within infection control, whether it's nurses, public health professionals, physicians, those with lab backgrounds. And our mission is to provide pathways to demonstrate and maintain competence in infection prevention and control, with a vision of a world free of infections through demonstrated professional competency. Now, some of you might be familiar with APIC, the Association for Professionals in Infection Control and Epidemiology. CBIC is a subsidiary of APIC. We have a separate board of directors, and we are completely separate, but we work closely with APIC on a variety of activities. And then we also have APIC Consulting, which is our for-profit branch that does a variety of consulting services within infection prevention and control. Now, I want to hear in the chat why, those of you that are here, why are you considering certification? Is it required for your job? Is it a career change? Is it personal professional development? It's always helpful for me and our board to find out why those of you that are considering certification have chosen this. So I'll see in the chat, we've got people from Phoenix, okay, Washington, Utah, great to see. Career change, okay, I hear that a lot in terms of reasons for pursuing certification. So CBIC has several different certifications, the first being the CIC. Now, this is probably the most popular because it's been around for 40 years now. So the certification in infection control has over 9,600 individuals worldwide that are certified in over 47 countries. So CBIC certification is truly global in its reach. Now, we also have two other certifications. We have our Associate Infection Prevention and Control Examination. This is our novice entry-level certification. And new as of last year is our long-term care certification in infection prevention. As I'm sure you all know, long-term care facilities have their own unique challenges when it comes to infection prevention and control. So I'll touch briefly on all of these examinations today, as well as the process of how to apply for the exam and how to prepare for the exam. And just reading the chat, I see role change, professional development, career change again. So I think, you're definitely on the right track for a career change if you're pursuing certification. A question that I'm often asked is, what is the difference between a certificate and a certification? You'll see a lot of certificate programs popping up within infection prevention and control. And oftentimes certificate programs are great stepping stones to certification, but they're quite different. A certificate is earned following the completion of a course or series of courses that provides education and training around an intended learning outcome. Maybe you go to a 2-day workshop and you get a certificate of completion. While that's helpful, that is not considered certification. Certification is awarded following a successful completion of a comprehensive exam process. And it's truly an independent assessment of your knowledge, skills, and abilities that are required for a competent performance of an occupation or professional role. And I like to think of a certification as something that's done independently, it's proctored, it's closed book. And, I think as hiring managers, for those of you that will be meeting with hiring managers over the next few years, You'll see that there's definitely value in certification from a hiring manager's perspective. They certainly see that a candidate that has a certification has gone through a rigorous process and really knows their stuff when it comes to infection prevention and control. So when we look at the value of the CIC, just one of our certifications, there was a great study done in the American Journal of Infection Control in 2019 that shows that certification through the CIC supports higher salary compensation, who doesn't want more money, increased job satisfaction through structured career development framework, improves patient outcomes, and advances evidence-based infection prevention practices, and is valued by the public and within the healthcare industry. Additionally, those that are certified that are IPs, infection preventionists, actually have a stronger understanding than those that are not certified for certain infection prevention and control practices. This goes back to patient safety once again. And those that are certified are actually more likely to recommend these best practices in the hospitals where they work, especially when you have your lead IP that's certified. And hospitals that hire individuals that are certified IPs are actually more likely to implement these best practices when it comes to infection prevention and control. So this is great data that really supports the impact and the value of certification. Now, I'm going to talk a little bit about our exam development cycle. I'm sure many of us have taken exams in high school, college throughout the years, and generally, these exams were written by one person, our teacher or the professor, and the passing score was usually around a 75. And I think oftentimes we've left an exam room thinking to ourselves, that's not what I studied, and that's not what I actually did in the class or what I do in my job. So we take a truly scientific approach to developing our certifications. Every 5 years, we do what's called a practice analysis or a job task analysis, where we ask those that are certified in the field, what do you do in your job? How important are these tasks? How often are you doing them? How important are they? The importance, the frequency, because we want to actually find out from those of you that are practicing in infection prevention and control what your jobs look like and what's changed over the last 5 years. I'm sure many of you that worked in the field during COVID, there's a lot of changes that happened, and our exam needs to reflect best practice and what's currently going on in the field. So we do a full-blown survey that we survey well over 1,500 to 2,000 individuals to find out what are the themes. And this is what develops our test specifications or the content outline, which is essentially the outline of what's on the exam and what percentage of each content domain is on the exam. And we have a team of volunteers. We have about 60 test committee volunteers that are actively certified through CBIC from around the world that write test questions according to these test specifications. And we have a list of our primary and secondary resources that were used to develop the exam on the website for you to go ahead and see that list. And we don't stray from those primary or secondary resources. All the test questions are written directly using those resources as a guide. And from there, we assemble our test forms. So there's not just one version of the CIC. If you and your colleague are taking the exam on the same day, you'll have slightly different exams. They are the same difficulty level. They all follow that same content outline. But for exam security purposes, we have several different versions of the exam. And we beta test every question that's on the exam. Thinking back to your other exams you might have taken, you might have said, this question's got more than one right answer, or this question is poorly written, or there is no right answer. We don't want any of our candidates to experience that on exam day. So before a test question is actually considered a scored item, it's often on the exam as an unscored item for about a year, where we gather statistics on that item and find out, are people answering this question correctly? Is everyone getting it wrong? Is something miskeyed on the question? So until we can deem it's a properly performing item, it's not considered a scored item. When you sit down to take your exam, consider every test question as a scored item because all test questions are labeled the same way within the examination. And from there, we set the passing score and this cycle repeats itself. So we are constantly writing test questions. You shouldn't encounter anything on a civic examination that's out of date or no longer best practice because this cycle is constantly in flow. So I put together a few steps on how to prepare for certification. The first one is reviewing the exam eligibility guidelines and understanding the differences between the exams. So we have 3 different exams, and all of them are slightly different in terms of recommended years of experience and practice setting. Now, these are guidelines to take the examination. They are not requirements. Anyone can apply for the exam, but the guidelines are in place by the board of directors, ultimately to set you up for success on exam day. For the CIC, our eligibility guidelines include post-secondary education in a health-related field. This can be medicine, nursing, lab, or public health. And by post-secondary, we mean, public or private universities, community colleges, etc. Once again, not a requirement, just a guideline to do well on the examination. But if you don't have that post-secondary education, you can certainly still apply for the examination. Number 2 is having direct responsibility for infection prevention activities in a healthcare setting. Having that hands-on work experience is a great way to prepare yourself for the exam. And having at least a year of full-time employment or 2 years of part-time employment or 3,000 hours of work over the last 3 years. Now, once again, this is just to have experience in the field, so you can not only, understand and apply the question, but really understand the question from the level of a CIC that's got about a year of full-time experience. Now, our AIPC exam, this is our introductory foundational novice level exam. We don't have any job specific or education requirements for this. And oftentimes this is a great stepping stone either to the CIC or to prove your foundational knowledge, interest, and dedication to the field. And I've heard firsthand from hiring managers that when they're hiring a new IP, if someone has their AIPC certification versus a candidate that doesn't have certification, that candidate that's gone through a rigorous certification process really stands out to the hiring manager as someone who's put in the time and the effort and the studying to develop their skill set to be ready for civic certification. So keep that in mind if you're looking to enter the field or take on a new role within this profession. My next slide goes over the AIPC certification. And like I said, it's an entry-level exam, great for those of you that are wanting to gain experience or have that professional career change. And my next slide is the long-term care certification. So the long-term care certification is quite similar to the CIC in terms of eligibility guidelines. I would say it's the same difficulty level as the CIC. Just because it's a different practice setting does not mean it's any harder or less difficult than our CIC. And once again, we want you to have post-secondary education and having experience within infection prevention within a long-term care setting is really crucial to prepare and be successful on this examination. Now, the next step is reviewing the examination content outline. I put these in my slide deck, but they're on the website as well, along with the percentages. So different areas on the exam have different percentages on the exam. For example, environment of care versus management and communication all have slightly different weights. Now, you'll notice the CIC and the AIPC have the same content outline, but when you go to our website, you'll see different percentages or different weights in terms of the CIC and the AIPC. Now, the AIPC is a shorter examination. The questions can be considered a bit more recall type question. And once you get to the CIC is when you'll start seeing more case-based questions, where you really need to understand the concepts involved to do well on the CIC. But the AIPC is a great way to start to prove your foundational knowledge. Now, the long-term care content outline is also quite similar to the CIC, but you'll see that first area, long-term care settings. This is a really unique part of this examination. We have residents living in congregate settings. We have families visiting. We have people with infections that are living together. We have socialization. We have pets potentially in these long-term care facilities. So these are really unique things that you need to know to be successful on that examination, along with all of the other domains on the exam. The third step to prepare for certification is developing a study plan. And I'll talk a little bit more in my slides about some resources that are available to you. My advice is to always work backwards from when you'd like to take that exam. If you'd like to be certified by the end of the year, work backwards from, a December exam date. Think about the kind of steps that you need to take to get yourself ready. Look at the content outline. Are there areas that you're not familiar with? Definitely focus your studies on those areas and do things like take a practice test. APIC has lots of materials available, including practice tests, to really use those results to determine where you should focus your studying. My second tip, I think, is so important, and that's reviewing questions that you answered incorrectly and learning from those questions. So seeing that you answered a question wrong is one thing. Understanding why is very crucial to getting to that next step. Reviewing the primary and secondary resources used to develop the exam. Like I said, we don't stray from those when developing our exam. We don't use personal experience or Wikipedia to develop the exam. We use a very set list of primary and secondary resources. Developing a study plan and dedicating time each day to reviewing content, keeping flashcards and studying on the go. I know you're all busy with full-time jobs. APIC does a great job with supplying things like flashcards and apps to help you study on the go. Join a study group. So this chat is often a great way to meet other people. So if you're interested in forming a study group, feel free to put that in the chat. Otherwise, your local APIC chapter, LinkedIn, Facebook, WhatsApp. I see a lot of candidates studying together. So celebrate your successes and get diversity in your study group. Maybe someone has a lab background, someone's got a long-term care background. These are great ways to learn from each other, no matter what exam you're pursuing through CBIC. The next one is follow the timing and the break structure that's used on exam day. The CIC and long-term care exams have 150 questions and 3 hours to take the exam, while the AIPC is 100 questions and 2 hours. If it's taking you longer than the time that's allowed on exam day, you're not ready to take that examination. So get yourself used to sitting down and following that timing structure and the break structure that's used on exam day. There will be no surprises on exam day in terms of the format of the exam. It's all multiple choice questions. So get yourself in that mindset of sitting down to take what's actually a quite long exam and utilizing the break structure. And finally, don't memorize content, understand content. So CBIC certification is, part of it is memorizing some basic concepts, but you really need to be able to apply and understand the content to be successful. The fourth step is reviewing the CBIC Candidate Handbook. Certification is, it's quite serious. We are accredited and there are rules that need to be followed on exam day. We do require everyone to read the handbook and at least attest to having read the handbook prior to applying. Once you have been approved to test, you are given a 90-day testing window. You do need to test within that 90-day testing window. So if you're not ready to apply and test within the next 3 months, I would advise waiting until you're ready. I'll talk a little bit more about how the exam is delivered, but we partner with Prometric, which is a US-based testing agency, to deliver our exam. Schedule your appointment as soon as you're approved to test. Exam appointments are first come, first served. Oh, I think we've got someone not on mute here, and we want to make sure that you schedule as soon as you can. The next is reviewing the cancellation. Let me see if I can mute whoever that is. Okay. And then reviewing the cancellation and rescheduling policy. Prometric is a vendor that delivers exams for numerous Looks like I got muted as well. So making sure that you review the cancellation policy as well as any rescheduling policies. And preparing for exam day, step 5. So like I said, we partner with Prometric to deliver exams in a secured proctored environment. You will be monitored throughout your entire exam experience, and you can actually take the exam 5 to 7 days a week. We do offer testing every day, and you have the option to test at a physical testing center or actually take the exam at home using live remote proctoring. If you're taking the exam at home, I like to say you will have the same experience no matter where you are in the world. We've got testing centers in over 160 countries. You'll be monitored throughout the exam in a secure environment. You can have noise canceling headphones, and there will be a test administrator that's watching and recording you throughout your exam process. I like to say if you have any hesitation about your internet capability or your software that you might be running at home, go to a testing center. I might be a little bit old fashioned, but I always prefer to go to a testing center versus testing at home. But there are a lot of people that feel more secure testing at home. They're more comfortable testing at home. They've got great internet access. So if you're testing at home, they will have a proctor that will do a full room scan. They will look at your ceiling, your floor, your desk, under your desk, make sure you have no study materials, make sure your browser is locked down, and a proctor will actually watch you throughout your entire exam appointment. So some helpful hints for taking your exam: if you're testing in a testing center, confirm that appointment, know where you're going. If you're testing remotely, do a system check. Prometric has everything laid out for you in terms of what software your computer needs to run, the internet speed that's required. Do all of these tests prior to your big day. Arrive at least half an hour in advance of your appointment. Make sure your government issued ID is valid, it has a signature, your photograph, and leave study materials at home. These are not permitted on exam day or during break, so leave them home. And then after the exam, you find out your results immediately. So as soon as you submit your exam, you will get a pass or a fail message. If you pass the exam, you'll only receive a pass. If you are unsuccessful, you will actually get a breakdown that shows the areas on the exam where you need additional studying. And there is a mandatory waiting period in between exams as well. For the CIC and long-term care, there's a mandatory 90-day waiting period. And for the AIPC, there is a 6-month waiting period. So the final step is maintaining certification. This might be jumping ahead, but want to make sure that everyone knows what's in store once you're certified. All civic certifications are valid for 5 years. If you're certified through the CIC or long-term care, you can earn continuing education units, IPUs, to maintain certification or retake the exam, and the AIPC can be maintained through examination only. Now, I'm going to talk a little bit about some APIC resources that are available. So many of you are kind of just getting started in this field, and we have a variety of courses available to you in terms of training opportunities. So based on the number of years that you've been in the profession, we have a course for you. So for 0 to 3 years, our Epi Intensive, our long-term care essentials, is a great way to get that foundational knowledge, to kind of just get that confidence to even be ready for certification. And for those of you that have been in the field for a few years, we have prep courses for the CIC and long-term care exam that will really point you in the right direction and get you ready for exam day. And here's just a little bit more information about the Epi Intensive, which is really just everything you need to know for essential IPC training within acute care facilities. And then for those of you that have more of an interest in long-term care, we have our LTC IP Essentials courses. And these trainings are available either in person or virtual. And then our prep courses are pretty self-explanatory in terms of CIC or long-term care. Now, before I actually open up to questions, I'm going to stop sharing my screen, and I'd like Martin to go off mute. So Martin is a recent CIC. He earned a CIC in October of this year, and he's going to share a bit about his experience and his career journey. So Martin, I'll turn it over to you.
Hey, good afternoon, everybody. Yeah, my name's Martin Taxer, and I'm a nurse officer with the U.S. Public Health Service, and I work on the Navajo Nation at Winslow Indian Healthcare Center. And we have a snow day today, so I'm here with my cat, Emma. So it's the two of us. Let's see, I became an infection preventionist in late 2021, so a little over 2 years ago. And I set a goal at about 2 years to become CIC certified. And so I feel like I gave myself a pretty good amount of time to do it. You know, you might be under pressure in your positions to be certified in 6 months or a year, or, you know, it depends on what position you're in. But I had a good amount of time, so that was on my side. But a lot of the preparation that I engaged in was, of course, being involved with APIC and my local chapter. And I mean, like, lightly involved. I'm not like going to every meeting, but I did find out like through some of the monthly meetings that there was a study group available. And that's really how I started it about 2 years ago, is joining a study group. And the study group just said, hey, commit to being with us. It's once or twice a week, I forget, but it was kind of sucked because it was in the evenings. It was an hour, it was a lot of personal time that you had to commit, but it really helped. And there were like 10 or 12 people at first. It whittled down to like 4 or 5, and then you had this committed group, and we really stuck together for months and months. And through those interactions, you hear about other resources that they're using, videos on YouTube that they may have found. And there's tons of those, by the way. If you Google YouTube, you're going to find a CIC study group. So look on YouTube for resources. But so looking at your local chapter and seeing if they have a chat group available, some sort of online meeting group, that's highly valuable. And then, of course, as Jessica had mentioned earlier, getting a time frame together and working backward from there. I started off with 2 years, but then I condensed it at a certain point. At a certain month, I said, okay, I want to take it in August, or I ended up taking it in October, but you can kind of work back from there. I took as many of the APIC modules as I was able to, and some of them are more rudimentary versus test specific. They just give you a basic knowledge for the fundamentals of infection prevention and control. So they're helpful, but not as helpful, I found out, as really just looking at the practice exams, taking multiple practice exams, and then taking the CIC prep course. And that was recently developed by APIC. It was released last June, so it's fairly well updated. Very valuable, not cheap, but you have to look for resources. Again, and I know all of this can't come out of our own pockets. It's a lot of money, but look for resources either through your APIC chapter. There might be some scholarship resources out there. Perhaps your workplace will help. NIHB sometimes has opportunities. Project First Line sometimes has opportunities. So look at those. That can kind of take a little bit of the burden off your wallet and help you to focus on the exam itself. So the CIC prep course I found was extremely helpful. There's practice exams built into it, as well as tons of study materials. But really, I started getting more confident after I started taking prep exams, the 3-hour, 150 question type exams, the ones that mimic the real exam very closely. I took as many as I could through the APIC resources, and then I bought as many as I could through Mometrics, another provider for exam preparation. And you take it and you feel kind of weak because you don't do very good the first time, but then you look at what you did not do good on, you study those, you understand why you didn't do well, and each time you take it, you do better. I think I took 10 or 12 practice examinations. I started feeling really good about it. The first time I did not feel good at all, but after like 6, 7, 8 of them, you start feeling much better. Understand the content of the examination too. Understand that there are certain topics and a certain number of questions coming from each of those topics. And those are all broken down on the CBIC site. As well as in the APIC CIC preparation course. So you can kind of find out I'm strong on this topic, a little weaker on this topic. And then probably the last thing I'd do is give yourself permission not to pass the exam. If you don't pass the exam, it's fine. You're going to still go to work the next day. You're going to have an opportunity to take it again. I know it's going to cost more money, and that's no fun. But I really went into the exam with permission not to pass it, knowing that I'd prepared and done as much as I could to do well, but also giving myself permission not to pass it. It took a little bit of stress off. And so I think if you do that, you might just go into the test with a better mindset. I will say I did take the exam in this same room here, and I don't recommend taking it online. I agree with Jessica. I like to go to a formal center. I live in a remote area, and so I did have to take it remotely. What I found difficult was that they wanted to scan the entire room, which is no problem. I've got nothing to hide, but I've got like this 50-pound PC with a camera built into it. So I kind of had to pick it up and shift it around the room. If you just have a small laptop, that's going to be much easier, but be prepared to go through that evaluation ahead of time. Try not to get stressed out. Because you want to start the test in a good, even mindset. Eat a good meal ahead of time, have plenty of protein. The brain, when you're taking these examinations, burns through a lot of glucose, so it's not a good time to be fasting or on any sort of strange diet. Make sure that you have plenty of fuel for your body to take that 3-hour examination, and only enough fluid to have one break. I'll take any questions, or Jessica will, I'm sure, but that's about as much as I have. Congratulations for coming this far and being excited about studying for the CIC exam and becoming a certified infection preventionist. And I wish you all good luck.
Well, Martin, just one quick question from me as I hear
Yeah.
people are interested in career changes. Has this
Mhm.
been your career since day one, infection control?
Oh, no. Actually, I've been a public health nurse primarily since 2005 here on the Navajo Reservation in northern Arizona. And I started in infection prevention in late 2021. So year 3 for me. Now, most healthcare providers dabble in infection prevention here or there, but as far as being a focused career, it's been about 2.5 years now, and a CIC for 3 or 4 months.
Well, I see some great resources in the chat about, are these prep courses still available? Yes, they are. So I've answered that in the chat. APIC still very much has these both in person and virtually. And Adriana, I know you put some information about scholarship opportunities. I clicked on this link. Is there anything that you can share? And then we'll open it up to questions from the attendees.
Good afternoon, everyone. As many of you do not know, Happy New Year. This is the first webinar with Dree. We do have a new staff person that was moderating, Tyrone. We're blessed to have him. He comes from Johns Hopkins, and he's all into infectious disease epidemiology, and he's also working towards the CIC certification. So we will in-house be pursuing this. So first off, I'm asking at least 5 people on this call to come on this journey with me. We have the money to support you to come on this journey with me. What happens is the only thing that I would need is just an official letter from your supervisor or tribal council acknowledging that you are pursuing CIC, CBIC, or dental certification. And then you also have to have an agreement to stay with that tribal facility for at least a year after you pass the certification. And that is it. And you have the autonomy to send me the classes that you need to take to prepare yourself for that certification. As Martin talked about, we provided him the funding, the finances to his flashcards, the workbooks, the actual books, any pre-test that he needed. We want you to be successful. You have to tell me what you need to be successful for me to provide you that support to be successful. So that